I don't think that there is a negative with embracing things that make sonographers' lives easier when it comes to
Right.
scanning, but I'm also someone that thinks it's very important that the sonographer knows what they're doing and why they're doing it.
We've been talking a lot about the shortage of sonographers lately. The demand is high, and the truth is that the supply can't keep up. Of course, at the forefront of this conversation are our diagnostic medical sonography schools and programs throughout the country. Here today to give us an inside look at the state of sonography education is Megan Platfoot. Megan is the program director for Diagnostic Medical Sonography at Clark State College in Ohio. She actually developed the DMS program there and took it through the accreditation process of not one, but three concentrations, abdominal, OBGYN, and vascular. She is, of course, a sonographer herself and holds a Bachelor of Science in Sonography from the University of Findlay and recently attained a Master of Education from the University of Toledo. So she's very involved in sonography education and is a great person to speak on this topic. So we appreciate you being here, Megan.
Yes, thank you for having me.
Like I just mentioned earlier, staffing shortages are all too common now in healthcare, and sonography is no exception. We actually recently had a conversation with Matthew Cox. He's the technical director and educator of adult echo at OSF Healthcare in Illinois, and he explained the power behind on-the-job training as a method to help alleviate the shortage that a lot of facilities are feeling. Now, I'm not trying to pit both of you against each other in any way. I'm sure Matthew holds sonography schools and programs in a high regard. But I would like to start on this topic of on-the-job training with you being a program director of a DMS program at a school in a more traditional setting. Um, you know, because it has become a bigger topic. And a lot of facilities are looking at this and saying, hey, how could we get more sonographers? Maybe we ourselves should start programs like these. So what are some of the key skills and knowledge areas that students gain through DMS education programs? If you could just give us a rundown, and what would you then say are the key differences between on-the-job training in a clinical setting and your setting?
Sure. So I think while in sonography programs, students learn everything about sonography. So that
Hmm.
includes the didactic components of sonography, so things like anatomy, physiology, and pathology related to the offered concentrations of the program. While in the program, they also learn things like sonography physics, which any sonographer knows is vital to know because that's basically
Yes.
how sonography works. They
Mhm.
also complete the required clinical components of their
Mm.
programs. So students are learning how to properly scan anatomical areas through on-campus labs and working on image optimizations with the lab component. In our program at Clark State, we respect and highly value our clinical instructors and sonographers at our clinical affiliates
Mm.
for their part in their education of our students. Students do have the opportunity there to learn valuable information and work on improving their sonography skills and recognize pathology during their clinical education in hospitals and
Mm.
offices.
Okay.
I think when we're looking at the difference between sonography education in a program and on-the-job training, I think it's important to know that it's not black and white.
Mm.
I think
Yeah.
if you're thinking of on-the-job training with sonographers, it's important that the sonographer does have some sort of didactic component, so does have the
Right.
book work when it comes
Yes.
into it. But I think that sonographers are highly adaptable. And I think that we have to respect the education that goes into the sonographers that are working in the field too.
Right, exactly. So,
Yeah.
okay, so in your program, though, for instance, you would say that there's still that mix of the clinical side, that
Oh,
clinical
absolutely.
experience, which I'm sure a
Yep.
lot of DMS programs have, but in your case, in your example, that is an important part of it. So the students shouldn't feel like they're
Mhm.
missing out then.
Absolutely. So in our program, our students are taking several didactic courses offered in a variety of formats. So they're
Hmm.
offered in person, online, depending on the course. Our students actually complete over 1,000 clinical hours too. prior to
Okay, wow,
graduation.
yeah.
So it is vital that our students do have that clinical component with it as well.
Yeah, that's excellent. It's true that
Yes,
that's so critical, really, to arrive at
it
the
is.
facility once you
Absolutely.
graduate ready, not just with the head
Yes.
knowledge, but with the experience. Yeah, absolutely,
Yes.
absolutely.
Mhm.
Now, I want to shift a little towards how DMS education has changed over the years because it's no surprise to everyone who's in sonography and medical imaging as a whole that there's been a lot of advancements, especially with technology. For example, AI. AI is the big topic in recent years,
Yeah.
especially, with ChatGPT and things like that.
Mhm.
For example, there was recently a study that I saw that they tried using ChatGPT to pass radiology board exams, and it succeeded in certain cases or got very close to succeeding, which is a little scary in the way that we're
Yeah.
advancing this fast, but logically that's just the tip of the iceberg
Mhm.
because it's new. And so how would you say DMS education has changed over the years, and what are the emerging trends and advancements that you foresee personally shaping the future of what we're doing to train new sonographers?
So I think, as with all things in healthcare, sonography is not alone, that it's constantly changing and evolving. It is
Right,
important that sonography programs maintain the standards of the field and to provide
right,
education to students on new advances in technologies and best practices.
yeah.
I know you mentioned AI. I think that would be my go-to when I see trends and advancements in sonography. I think AI can very much help aid the sonographer in their day-to-day
Mhm.
practice. But I do think it is important to recognize and appreciate the knowledge and expertise of the sonographers, that
Absolutely.
AI is used to help, it's to aid the sonographers and
Hmm.
not necessarily
Yeah,
replace them,
yeah.
which I think is a conversation that comes up in sonography a lot. In education, I am an educator. I do hear about AI and chat GPT and the fun things
Hmm.
that come along with it. I
Yeah,
think, like you said, it's here to stay. We're very much on the tip of the iceberg when it comes to it.
yeah.
And I think sonography programs themselves and sonography as a field, we're learning to adapt with it and to try to take, to see it from a benefit. And
Hmm.
to really kind of use AI and that kind of thing to help the sonographer, and to try to make their lives a little bit easier when it comes to scanning.
Right now, do you see it
Mhm.
as a challenge for new students that there's such a rapid introduction of AI? Do you think, or have you perceived a collective fear of like, oh, are we going to be replaced? Which, I know you don't believe that that's the case, and I don't either, but still, to someone new who's coming in, maybe they think that.
Sure.
Or do you think that there's also the risk too that we have new sonographers maybe who are no longer perhaps putting in the same effort maybe because of a reliance on AI? Are those things that you've perceived, and how have you addressed that, if so?
Yeah, sure. I think it's important as a sonography educator to really teach a well-rounded education when it
Mm,
comes to it. I don't think that there is a negative with embracing things that make sonographers' lives easier when it comes to
right,
scanning. But I'm also someone that thinks it's very important that the sonographer knows what they're doing and why they're doing it. So
exactly.
if AI is going to make their lives easier, they still have to have the knowledge behind what AI is doing. That way, we all know that technology is great, but it doesn't always work the way we want it
Exactly.
to.
Yeah.
So it is very important that sonographers and especially sonography students, they know where sonography came from, how much it's adapted, how much it's evolved, but they still can take advantage of the advancements that is coming in the field.
Exactly. That's really
Mhm.
true. And the other thing too is that I feel like, in the media, sometimes it could seem as if AI is being implemented extremely fast into healthcare, into
Yes,
sonography, but it does take time to validate these things, right? We had
it
had
does.
a conversation last year with Kristen Billick, who's an Echo Lab manager at Scripps Health, and it was on AI. And she mentioned how these things do have to go through a lengthy validation process before they're actually used, on patients in
Yeah.
those settings. So it's not always as fast as we think. And that's something I think that students need to keep in mind. New sonographers have to
Mhm.
keep in
I
mind.
agree.
But so true what you say, though, about the foundation. If the foundation's not there, it's not going to work. Moving on to other potential challenges, though, what are some that you think are being faced by educators who are pushing to deliver effective DMS education, especially in settings like yours in schools, but also maybe the clinical setting as well?
Mhm.
And how would you address those challenges to provide the best learning experience to the students, to the new sonographers?
So I think with all education, it's important to understand that all students may learn differently and to always
Hmm.
have the success of the student at the forefront. Ensuring the students have a quality education and opportunities while having highly knowledgeable faculty is crucial in programs. I do
Hmm.
think it's also important to have a close working relationship with clinical affiliates in the program. They not only ensure that the students are being exposed to a variety of ultrasound examinations, but that it's important for the programs to ensure that the clinical affiliate feels supported and appreciated for the work that they do with students. I know I mentioned earlier our students complete over 1,000 clinical hours. They complete that between hospitals and offices, depending on the student. Those clinical instructors, the sonographers that they work with, it is so important to me that they feel appreciated for the work that they do.
Yeah.
Day in and day out, when they're working with our students, they're influencing their education. They're also influencing the type of sonographer they'll be when they graduate. So I think having that close relationship, having the communication with the clinical affiliates is so important when we're thinking about sonography education.
Absolutely. I mean,
Yeah.
those are the role models, right? Basically. So
Yes.
someone who's not there yet, so important to have those partnerships, those relationships. So like we've already talked about, sonography is always evolving, as with the
Mhm.
rest of healthcare, especially with such a, how one might say it, like technology based, right? As
Yeah,
it is,
sure.
this is something that's changing. And this is something that I do hear often from sonographers. Oh, it's always changing, especially those who are pretty heavily involved in the societies and are attending meetings, and they're seeing this new research, new things that are being presented. It is changing. So,
Mhm.
as a program director, what strategies do you employ to ensure that DMS education remains relevant and that it's aligned with the needs of patients and that it
Mhm.
doesn't, stay behind?
Sure. So in our program at Clark State, we rely heavily on our medical advisor, our advisory committee, the clinical affiliates, like I mentioned earlier,
Right.
our accrediting body, and also continuing education through professional organizations to ensure we're staying up on the latest advances with sonography. I do encourage our students to join professional organizations as well. So things like the Society of Diagnostic Medical Sonography to
Right.
encourage their participation in the organizations that are devoted to our profession. So I do think, trying to stay relevant and trying to stay aligned with the needs of the healthcare industry is so important. But it really is a combination from a lot of different people to make sure that not only are the programs aligning with what's being done clinically, because
Yeah.
that's what the student's being prepared for, but also to ensure that the faculty that are teaching the students, that they are really staying up on the latest advances and the latest best practices to help the students as well.
Know that the faculty of these programs is also a big factor in why a student may choose it, right? If they see that the faculty
Absolutely.
is very active. So that's really important. It is.
Mhm.
Now, there might be some clinicians watching this who maybe they themselves are not diagnostic medical sonographers, but they're looking to make a move, or perhaps we even have some students who are watching it and are already in a program. So, from your experience, if we could end on this question, what skills and qualities do you believe are crucial for future diagnostic medical sonographers?
So it is the responsibility of our program at Clark State to ensure we are providing our students with the best education possible. I do think that this includes giving them the tools they need to develop into quality entry-level sonographers. Now, while the didactic component of sonography is important, I also
Hmm.
believe students are learning the ins and outs of working in healthcare. So they learn how to communicate properly with not only patients, but also other healthcare workers like doctors, nurses, and all the great group of people that work in healthcare. healthcare. I think the importance of ergonomics is also a key component for sonography students. And if you're talking
Yes.
about sonography, you have to talk about ergonomics. We cover ergonomics and the importance of best practices while scanning throughout our program at Clark State. We want all of our students to have long, pain-free careers. I also encourage my students to never stop learning and seeking knowledge even after they
Yeah.
graduate. I think even after, their time as a student is done, like we've mentioned throughout this interview, I do think that this field is constantly changing. So I think as the field is evolving, it is important for all sonographers to stay up on the latest and greatest in the field.
For sure. I mean, you mentioned so many important things. One of them being, of course, communication, which
Yes.
I know is key. It's a very how would you people-facing role, absolutely, like most of
Mhm.
healthcare, right? And then
Yes. Yep.
ergonomics, such a big topic, something that we need to create
Mhm.
more awareness of. So I'm really glad to hear
Absolutely.
that in your program you talk about that, how to avoid those work-related musculoskeletal disorders.
Yes.
It's so important. It's too many sonographers, especially over the course of time, who just develop those, and that's being having a pain-free career is important. We need more sonographers, and to do that we really have
Absolutely.
to teach ergonomics so that people stay in the
Mhm.
field and are able to have be able to thrive in their role,
Yep.
really. Yeah.
Mhm.
Well, thank you so much again,
Mhm.
Megan. I mean, thank you for what you do for, educating the next generation of sonographers. Like we said, so important. We need more, definitely not less. So thank you.
Yes.
Thank you for taking the time to share all of that valuable information.
Yep. And thank you for having me.